everybody. Hi, my name is Kim Gilyard, and I'm the owner here of Gilyard Medical Massage. And we will be turning that right after. We're just going to have the meeting in here. So today I wanted to talk a little bit about lymphedema, some of the more known but also lesser known problems associated with lymphedema. Also, we're going to talk a little bit about post-mastectomy scarring, so some people are interested in that. I wanted to go ahead and read the definition to you because it's going to be easier than me trying to explain it. Okay, so lymphedema is a medical condition of chronic swelling, usually of the arm or leg. The swelling is caused by damage to the lymph system, and this damage may be genetic or mechanical. So I didn't know some people are born without or very defective lymphatic systems, and so they get the swelling all over. So we just, some people are not aware that you can genetically have a problem with that. The swelling is caused by an accumulation of fluid composed of water and protein in the tissues of the affected body part. Normally, this fluid would be returned to the circulatory system. However, when the lymph system is damaged, it's not able to transport fluid properly. The result is accumulation and stagnation of fluid that appears as a swelling in the actual affected limb. The amount of swelling varies from individual to individual. Okay, so that's kind of the overall general overview of lymphedema. So some of the main causes of lymphedema, and we won't go so deep into this, but just kind of let you know that there are different causes of lymphedema. Filariasis is probably the most common type of lymphedema cause in the world, and it's basically more found in third world countries where there is a parasite that actually burrows in people's legs and it lives there, and what it does, it puts off a toxin that actually kills the lymphatic system over time. So that's when you will type up on the web and you'll see lymphedema and you go, oh! Yeah. That's usually people who are in a third world country and they have filariasis. Now, the bad thing about that is it is actually preventable, but they don't have enough medicine to go in and kill those parasites. And there are different organizations that try to go in and get them some of that to try to kill that. But yeah, that is actually the most common cause of lymphedema in the world. Also, we talked just a little bit about genetics. Some people are born without, very limited lymphatic systems or damage. So they continue to have problems through their whole lifetime with, getting a lot of diseases and, of course, having to go through a lot of treatment to try to keep that at a low level. Also, a little known cause of lymphedema is actually direct injury. I had a client about 3 years ago that I was treating. She was in a very bad car accident where her leg got crushed. So, of course, along with that, the lymphatic system got crushed. So she was having a lot of problem in her leg just because she had had a really bad car accident. So I always try to tell people that, some people call my office and they're complaining about this swelling, but they don't have cancer, they don't know where this came from, and so a lot of times it's because they've had some sort of injury. And then, of course, the main reason probably that most people are here is secondary to cancer treatment. So a lot of things happen during cancer treatment that will cause lymphedema. I wanted to do just a little bit of talk and kind of draw a little bit about, I have a lot of women that come to me and they'll say, well, I'm post-cancer 10 years and I only had 3 lymph nodes removed, and so I don't think that I'm in danger of ever getting lymphedema. So then what I do is I draw a little bit of diagram for them as far as probably what happened during their cancer treatment, and then they kind of look at it a little different. So like they'll come in and they'll say, well, I only had 3 lymph nodes that were affected. So we'll talk about that. So you say they had 3 lymph nodes that were affected. Okay. They also, as far as that, they had a biopsy. They took a couple before then. So you can pretty much say that's pretty conservative actually. And you say, well, they have 5. But what a lot of women don't realize is whenever they find those 3 lymph nodes and they remove them, they remove probably about 10 more around there, right? Just because they want to make sure that they've caught everything. So, okay, so you've got quite a few now, right? Also, when you go through chemotherapy, conservatively, let's just say 5 to 10, which is probably more than that. We'll put another 5 on there. Okay. Then we go through radiation, we'll kill some more, right? Okay? And we're just being conservatively saying 5. So your 2 or 3 or 4 just turned into that, okay? And hopefully you only have to go through 1 round, okay? So then when they look at that, they're like, wow, look at all those lymph nodes that possibly have a problem. So now you're getting into quite a bit. So I tell people that, you can't just go by how many were possibly affected. You have to go by removed and also the levels of treatment that you had. Sometimes people will go through chemo and not go through radiation, so maybe less have been affected, but it's still an issue, and people are affected differently by, chemo. So it could be a lot of them gone. So I tell people, just don't be overconfident. You still need to be looking for risk factors, okay? Also, so we'll talk a little bit about lymphedema, so how to recognize. Now, when I have women that come to me with lymphedema, most of the time they've already had it maybe a couple of years, actually, and sometimes that's conservative. Because after surgery, a lot of times the doctors, they'll come in and they'll complain about a swelling, and the doctor said, well, you're still in the healing phase, okay? Which is true, you're still in the healing phase. So they'll say, okay, well, it's severe, but I'm still healing. So then they'll go 6 months, it's still not really gone down, not resolving. They'll go a year, still not. So then they'll say, well, the chemo hasn't cleared your body, you need to give your body time to regenerate, it'll probably go down. So then they go another 6 months to a year, and then it doesn't go down. And sometimes it actually gets worse. So then they're really looking for, so hopefully they have an oncologist or a surgeon that can really recognize these things, because that doesn't happen all the time. So by the time I get them, it's noticeably swelling, or they might have had 1 or 2 infections in that arm. And sometimes I actually see that they have an infection because it's swelling rapidly. So then they're like, oh, I need someone to drain this. And I'm like, oh, you need to go to the hospital. You already have an infection, So we kind of look at that. Also, they'll, of course, this, signs, their rings will start, they can't wear their wedding ring anymore, or their clothes aren't fitting properly, or, one arm, the sleeve is tighter than the other. They start to feel a general heaviness or fatigue, and sometimes that happens before you even see it. So that kind of deal. Also, if they get a nick or a cut, it's slow to heal on that arm. Like it's like, man, I've had that cut, it's a small cut, but I've had it for 2 weeks, and something's wrong. Also, you may notice coloration changes, because one arm sometimes gets redder, or sometimes one arm gets darker than the other, because then you're looking at possibly having some fibrosis, which is kind of hardening of the skin, because there's been so much swelling that a lot of times the skin will lose its elasticity, and then it will have a lot of protein accumulation underneath there, and so then your skin starts to harden, and it will also discolor. So sometimes people will notice, especially if they're darker skin, one side is darker than the other. And then they'll be like, well, something's wrong. And a lot of times it is, they've already gone into a couple of stages where they're starting to have that. They'll notice that extreme temperatures start to bother them. So extreme, of course, San Antonio, gosh, this is the worst place in the world to have lymphedema, because then if they go out in the sun, automatically it just seems like the arm, or wherever it is, just kind of blows up. And sometimes it's little known that extreme cold will actually affect lymphedema, and very few people, I would say better to be a cooler climate than a warmer climate, but sometimes people are adversely affected by cold, so don't even be fooled by that either, because they can be affected. Let's see, so yeah. So, and of course, visual swelling. People start saying, hey man, your hand looks a little swollen, but sometimes it does kind of start in the lower extremity of the hand that's farthest away from the circulation, so it'll pull there. So sometimes people will notice that their hand is swelling. Another thing about that, comorbid conditions, so sometimes people will have arthritis, they'll have all these different things, and they'll think, oh, well, maybe that's just my arthritis acting up. So each time it happens, they're thinking this is arthritis, but it could be a combination of both, or it could, possibly could be the lymphedema starting. So you have to be really careful with that. Let's see, I'm trying to think if there's anything else as far as also little known kind of signs. People tend to, like, they'll go out and they'll do yard work, okay? And they're doing a lot of yard work, or they're doing a lot of repetitive motion, or they have a job they're doing a lot of repetitive, they're screwing something or whatever. And I've had lots of people come in and they're just like, I think I'm just overdoing it at work. I did have surgery on that arm, but now it just seems like I'm just getting tired by the end of the day. And it just seems like it's like, well, all of that activity could possibly have triggered you to have that. I've had women before who here they do a lot of gardening, and I'm like, I don't know why they would be out that heat, but a lot of people do. And I tell them, you have to, first of all, you have to look at what time of day you're out there. But the problem is when people have neuropathy, you can't hardly feel it either. So sometimes you're out there and you're thinking, oh, I'm having this good time, I'm digging through here, but you got to remember you have a reduced sense of feeling. So you can't always go by how the arm feels, because by the time you feel it, it's really bad, or it's really huge, and you look down and you're like, oh my gosh. So I always tell people that, in that instance, you need to, do things like, pace yourself. Or if it gets to the point in the summertime, I've had people come to my practice and I just had to tell them, you cannot be out there. You just can't. I don't care what you do. It just seems like it just gets worse. You have to, in the summertime, you have to have somebody come and help you or do that for you. So there's a lot of things about lymphedema that kind of come up, and sometimes it's sneaky and you'll think it's other things, but it's truly lymphedema. Whenever I see people, of course, I do not diagnose lymphedema as a therapist. I'm actually a lymphedema therapist, sorry. I'm also a registered nurse, medical massage therapist, lymphedema therapist. But anyway, I tell people that I cannot diagnose it, but what I can do is I can say, you know what, you may want to go to your doctor and ask about this. Because the problem is that some doctors, believe it or not, even oncology doctors, are not very versed at catching it. So you have to be ever vigilant, and a lot of, and they don't really give, you don't get really a lot of education about it until you get it. And unfortunately, that just scares a lot of women, and I have to spend a lot of time with, hey, calm down, well, I didn't know this was a possibility. That's what everybody says. Unfortunately, we need to get better education out there as far as posts to be able to find this. Because I think you had told your story how 2 months after surgery you would notice that you were swelling abnormally, and they were able to intervene. And that is basically the right thing to do.
Denise, PRMA.
So they were able to intervene with you very quickly, and actually you have a better result. Okay, so and that's what we're hoping for, is to be able to people be informed about possible things that can happen or instances where that can happen. Also, another thing that comes up occasionally is things that trigger it. So, the typical thing, they take bug bites, can trigger, taking blood pressure on that arm or limb can actually trigger that. A little known thing is actually massage can actually trigger it too if you get a person that is untrained. About 3 years ago also, I had a client that came to me, and she was very active pre-cancer. She had lymphedema, but what happened to her, she was going along just fine. She was, 10 years post, didn't have it. She decided that one day she was going to go to a massage therapist, and she was going to not tell him that she was an ex-cancer patient. Because of the fact that most massage therapists are taught at school is if you're not trained to do cancer patients or perform massage on them, then don't do it, because it can adversely affect them. So she says, well, every time I would tell a therapist that, because unfortunately there's very few therapists that are really trained in that, they would tell her that we can't do you, we can't perform anything on you because we could potentially harm you. So this time she decided she wasn't going to tell him. So she went in The next day, because he was working on her shoulder, the next day she had an implant and it fell out, literally, because he was working over here around these muscles and all this around her shoulder. So it fell, and then her arm swelled up really big. So she had to go into surgery, get the implant put back in. And then her arm was just all messed up, and so then that's kind of where I found her after the surgery. So so that kind of lets you know that, you know, when you have had surgery or cancer or that type of deal, you really need to get with a massage therapist who is actually trained to work on you. There are lots of different kinds of cancers. There's lots of different, you know, types of cancers, and you know, when you are trained to do that, then you can do it safely. But if you're not, you can harm someone. Yes.
Also, I don't know if you're going to address, but what about, because we've had patients come in, altitude changes.
Yes.
They don't have any issues until all of a sudden they get on a plane.
Yeah, we were going to talk about that. She's right. Okay. So travel, that was going to be amazing.
Sorry, I didn't want to.
Oh, but that's okay. No, that's good, because that's very important. So travel, changes in altitude, as she said, can affect you. You may not have any signs of lymphedema, but we've had people, and I've had lots of them, that go on an airplane and all of a sudden, all bets are off, man. They're swelling before they hit the ground. So it can happen like that, or it can happen gradually, because of course, you know, you got to fly back. So then you got a double dose of that. What we do is we have tips of things you can do as far as travel. You definitely need to wear your compression garment. Hopefully you have, and we will talk about that, a lymphatic drainage therapist that you can go to get ready or prepared for a trip. I do that quite often when I have clients that fly. And especially I have one that really flies for business. And so she comes in, she's like, oh, you know, I'm getting ready to go on an airplane. So she definitely gets that done. But if you're going on long extended thing that people don't realize is that a long times in the car will also affect you. So not only leg, but arms. For some reason that car motion will actually affect them long term if they're doing long trips. But you know, we do things like, as far as garments, trying to prepare lymphatic wise to do some lymphatic drainage, some types of massage therapy will help that. Also, you know, we'll get into that, but talking about different things. So nutrition is very important. They say that the biggest risk factor now of lymphedema is obesity. So if you're obese, they're saying that you have of course, a better chance of actually developing lymphedema over time. I think now it's up to like 40%. So that's one of the big things now, because it used to be kind of in the list, but now it's at the top of the list. So definitely, if you have weight control issues, you know, post-cancer, definitely need to do that, because the more obese you are or more weight you have, the more likelihood you are to get lymphedema. Okay, so you don't want to do that. Let's see, we talked about travel.
I just asked a question about when you're in the car. Is there something you can do to prevent?
Well, basically, it's just you get out, sometimes take frequent breaks while you're on the road. I mean, you can't do it in a plane, but you know, sometimes people can. But you know, you can take frequent breaks. You can try to keep the leg elevated if you can. So like if you're in the back seat, you know, well, legs too. So arms and legs. Or you can try to keep elevated. Like I said, definitely wear your garment, and you can exercise. You don't want to over-exercise, but sometimes that can kind of help move that fluid along. Self-massage is great. So you want to do that also. You know, make sure you stay fluid, because of course, with the lymphatic system, kidneys work to try to, you know, filter all of that. So if you're dehydrated, then guess what? You're already having a problem moving that protein. You're already having a problem with fluid. Then you're dehydrated. You're just, you know, it's not going to help you much. So you also want to stay hydrated during those times. Oh, also with road trips, definitely want to limit your sun exposure if you can. Sunscreen, bug repellent, all of that, you know, camping stuff that I don't do. That I don't have trouble with, you know. But yeah, so all these different precautions you want to take, you know, whenever you're doing, you know, road trip. And I do have some that do, you know, they have the trailers, and so they want to go on road trips. So they have their little packets of, alcohol, sanitizer, all this stuff ready, bug repellent. So you want to think about that too. Are there any questions so far that you guys have as far as anything that you're just kind of pondering?
Yeah, I'd only heard about lymphedema in your arm, so having it in your legs.
Oh, well, yeah, I mean, because if people have ovarian cancer, then of course it's the same
okay.
thing. They're just taking away,
Gotcha.
from there. So yeah, that's even more severe because I've seen it to the point where it gets that people can't walk, so it's very severe. Also, lower limbs, now upper limbs also can get quite a bit of cellulitis or infection in the arm, but the lower legs, they get fungals. It's really, if they get a problem, because the toes are down there.
Yeah.
So those things that are normally kept in check start to spread because of the decreased immune. So they really have a problem with that, so they have to kind of watch, if they have any type of anything going on and they see that doesn't look right, they need to get that checked out really quick because that can spread really rapidly. And so then you got the problem of trying to solve that. It's hard to get rid of fungals when you get that.
So you recommend getting a sleeve to wear in the car?
Yes. Well, yeah, sleeves, yeah, definitely for sure. If you're in the car, you want a sleeve. You're on the airplane, you want a sleeve. If you're outside, even though it's hot, and you're doing something outside, you also want a sleeve. But you want to take breaks in the shade or something covered to where you can give your arm a break for being in direct sunlight. Because I'm not going to say you can't go to a wedding. That's outside. You're going to go to a wedding. But sometimes people want to overdo it and they're outside doing concerts and they're doing all this and then then they're just in direct sunlight all day. And sometimes it's unavoidable, but you have to kind of do things before then to try to prepare for that. So we'll talk about, okay. So
I think she has a question.
Yes, I'm sorry. Yes, ma'am.
Before my surgery, I have hypertension, so there was times that when I would shop or so forth, my hands would get swollen or tingly. Now that I've had the surgery and I have lymph nodes removed, I'm really like you mentioned, you're kind of like can't tell the difference between having some type of arthritis or lymphedema. So my question is, is there a particular sign, a subtle sign besides the swelling that I need to look for to make a difference of what's actually going on? Because I do get the tingling in my hand as of right now. When I'm on my feet for too long, it does start swell and start getting big. But see, that was even prior to my surgery, so this is a continuous.
Well, basically what I would say is that you definitely, hopefully you're doing regular blood pressure checks.
Yes.
And sometimes people will have.
Well, I'm under my blood pressure medication and I'm doing fine.
Okay, you're doing fine. Because sometimes people will have like a bout of where their blood pressure gets high and then they'll have that headachy feeling or they'll have that fatigue feeling or they're having that insomnia at night. If you see, that going on a lot, then it might be closer to hypertensive. Maybe something is wrong or something happened where that went up. But if you have a prolonged swelling, you definitely need to get that checked because you could have a comorbid, you have the two conditions together that could possibly be. And so you definitely, and plus, okay, that brings up an interesting deal. Being that I've done this work for a long time, like 20 years or more, I've seen different swelling, traumatic injuries, you name it. I have noticed that there is a high correlation between people who get lymphedema versus people who have had previous injury to that quadrant. So what I'm saying is that if you have this right arm, this is pretty much a quadrant. So sometimes people will have a previous shoulder issue. They will have a previous, issue here or underneath here, or they've had tennis elbow, or they have all of these different conditions, or they've had some sort of hand injury that then predisposes them for lymphedema. Like they have a really good, and I always ask people whenever I'm interviewing them, I said, well, prior to this, have you ever had any problems with that? And I said, or any injuries, anything orthopedic that I need to know about? And they'll say, well, I have tennis elbow, I've had this and that, whatever. And then I see that, you know, there is a high correlation of people who have had previous injury or trauma to
She's
that.
at hairstylist.
Well,
I'm a nail tech.
Well, see,
So
and
I'm filing
yeah.
and I'm putting
And
pressure,
there-
and
and
sometimes
what
I
we
have to
just-
stop what I'm doing
Yeah.
and shake it
Yeah,
off.
and we just talked about that, so that repetitive strain, that
Yeah.
repetitive motion,
Yes.
if you do a job, then you're predisposed to that.
Yeah, and,
Yeah.
and I found myself, my boss, I've let her know to give me
Breaks.
a break. Like, I don't mind doing like manicure, something that's real subtle, and a pedicure, but when I do the acrylic set, where I'm having to use constant motion and some pressure, maybe after like the second clientele, I'll start to feel, not swollen, but tingling, like your foot fell asleep kind of feeling, and I have to stop what I'm doing and shake it off. So, and also to go back to what she mentioned about the sleeve, would it be wise that I wear a sleeve while I'm working?
Well, let me tell you, well, first of all, you probably need to go get a baseline to see where you are, because we're gonna go into that, but she's already opened the door. What I usually recommend people to do, and it's not like a general practice, but if I can catch people before, like in their first, and sometimes I do catch people when they're newly diagnosed, is to have them get a baseline of their arm prior to surgery. Because you want to know what both arms are looking like, your normal arm versus the arm you're fixing to get, you know, this part you're getting operated on. So you can have a baseline, because what happens, then after you have all of your things, you can continue to measure and kind of see where you are, okay? See, since we don't know what you were prior to, you know, it's
I
not
don't think
hard
I
to
had
do that.
increased too much because
Yeah.
I have a lot of tight sleeves,
Yeah.
tight tops, and I'm still able to wear them.
But see, the problem is you can be like 0.2 centimeters
Oh,
different,
yeah.
and then you can be, you know, literally have it then, but it's just not as noticeable, like you don't see it yet.
Right.
But it could be, and that's why we use more of a definitive measurement. There are machines that can do that. I don't think anybody in town has a bioimpedance, but where they can do water displacements and different things to see exactly like how much it is. So that's one of my soapboxes, is that prior to these surgeries, mastectomies or any other type of surgery, you definitely need to have the arm, a baseline. So then later on, if you get a therapist and it says, okay, well, what were you prior? Then we can kind of measure from arm to arm, you know, and then we can measure where you are now. And then we can say, oh, you're like a lot bigger, so we definitely need to, at minimum, start treatment. Or, you know, like you say, start reviewing some of the risk factors to try to cut down on, you know, you possibly having full blown. Because the earlier you get it, just like anything else, the earlier that you can detect that is the better that you have result. And unfortunately in this country, lymphatic drainage is not as widespread as it is in most other countries. So technically after these surgeries, you should be getting lymphatic drainage right away. You know, if you're clear from DVTs or blood clots and you're good to go, then you should start already, because it's going to help you in the long run anyway, as far as your healing process and the pain process that you go through. But we don't really do a lot of that here. Hopefully it's changing. Some places are. But yeah, that's one of the deals that you definitely have to monitor that. I would say get an assessment. Hopefully you have an oncologist that is familiar with it. They may send you to a PT to get assessed and see if there's just, you having a lot of problems with that, get you started.
Does the lymphedema come after y'all been diagnosed and the surgeries, or do people have it before and that's how they get that?
No, well, usually it's secondary to, I mean, if you don't have it before, it's usually no genetic or any type of injury, then it's pretty much related to the surgery. Like I said, you know, it doesn't matter. Yeah, how many lymph nodes, you can still, you know, if you've had a biopsy, you know, you can definitely do it. Sometimes people are getting on the oral cancer meds. You know, a cancer med is a cancer med. You know. So that's pretty much it.
I
So we
have
kind of
a
open it
comment
up.
that when she said she didn't know she had that lymphedema, I totally believe in therapeutic massage. I'm a PT, and I get massages, but I've not had the lymphedema. But stenosis also can cause all that tingling, and as you sit and not move much with your neck, the muscles tighten up,
Okay.
deep muscles, and you can get tingling going down your arms. And really, the way to figure out if it helps is to stretch your neck and learn the exercises that do that. And then otherwise, then you're, looking at other things.
And see, that brings up an interesting point. That was kind of another segue that I was going to go into.
We're just helping you along.
You just helping me out. I'm just kind of bouncing around here. But anyway, so that's the deal. So when you go to a lymphatic drainage therapist, if they have that background where they can do orthopedic kind of assessing to see if you have a structural problem too, what I usually do is I treat the whole thing. If I see that you come in, because I'm a medical massage therapist, so I can see if you have any structural difficulty that might be impeding your circulation and lymphatic system. So we can get all of that corrected at once and be able, now ideally you would want to actually do that pre-mastectomy or pre-surgery, because we can do a lot orthopedically to kind of open those areas. So as you have the surgery, then you're actually flowing a lot better and you may not have as much complication. Since that's not really in the system here in the US yet, hopefully that's changing, then even after, if you have problems, then that would be part of what's solving them. Sometimes that is the difference between someone that can get better results with lymphedema than other therapists that do or don't have time. Unfortunately, I used to work in a PT center, a couple of them, and they just don't really have the time to solve all the orthopedic and do all the, some manual therapy, and then they got to do this, because a lot of times they are pressed for productivity. That's one of the reasons why I stepped out of that, because I could actually treat the patient more, on my time and in my scope better than I could, as far as, well, you only have 15 minutes with her, versus in my practice I can take as much time as I want. So yeah.
Since I've had the history of it, been my bumper pad. Can you show my bumper pad?
Yeah, you can show me the bumper pad.
I haven't flown since my surgery or anything, but I might be flying in a few months. Would it be advisable for me to wear this and a sleeve?
Yeah, I would probably wear a sleeve, because just because you had it centralized in here doesn't mean that you don't have damage that could affect the arm there. I mean, it can happen at any time, anywhere. That, like I said, also if you have a lymphatic drainage therapist, it's good to get that treatment before too, so you can make sure that you don't have any swelling before you can get on there. So we want to keep it all together. But yeah, definitely wear your pad. But I would wear a sleeve always. Yeah.
Okay.
Yeah, there's a sleeve lady right there.
Have y'all seen these?
Yeah.
Because I had it under my arm.
Now, would the insurance cover the
lymphatic drainage?
This is my best
Yes.
friend.
No, that's the only thing. Since it's not really in the system, I wish I was in somebody's system to show them what can actually be done. But yeah, usually it's private pay, and we had to talk about that. One of my hopes is at one point around here is that when people get care credit, or, but you never know, it could be inserted in that system, because I know, is it a rule that after they have that first occurrence after the surgery, then they can have everything reimbursed? I'm not sure if that's, as far as, it's not? Okay, because I was going to say.
But the sleeves and the gloves are covered to a certain extent.
Yeah.
They're because it's a durable medical device.
Okay.
So the sleeve is covered, like if you get a Juzo, which is the best, in my personal humble opinion.
What is it?
The Juzo sleeves.
How do you spell that?
J-U-Z.
But does it also depend on what insurance you have? Or
Well, you know what? I have seen some.
because I work with the chiropractor,
I
they
personally,
get different
I
benefits.
personally is a lot of times even the whole system doesn't know what to classify lymphatic drainage. What they do is usually if you go to a PT, it is covered because it's under because they're considered physical medicine, so they're reimbursable. So if
Sometimes we can order, now I don't know specifically for the sleeves, because I've never had that.
Well, because
My
like they
back
order
is-
the,
Sometimes we can order DME.
like the
and then
machines
we-
and
they
some
order-
different stuff,
Yeah.
for the patients. I didn't know if that's.
but unfortunately it's not, really prevalent here in the U.S., so it's not really covered. Hopefully at some
Well, we're
point
really
it will be.
behind when,
We're really
grassroots
behind.
campaigns
Yeah.
trying to move forward, but it's just,
Yeah.
we're behind.
Yeah, because I have people, in fact, I had a lady from, I've had a couple of ladies, one from Germany. She was a post-cancer patient, and she came over here and she was just appalled that everybody didn't go get a lymphatic drainage treatment once a week.
Right.
And I was like,
everybody.
what? I need to move. She goes,
Let's go to Deutschland.
I said, I go to Germany.
So we can go.
She says, oh, yeah. And so she says, oh, you're very good. You do good there. I was like, I wish I could go there. So you guys are getting it real often. But of course, that's kind of where it originated too. So they, you know, but in Europe, actually, lymphatic drainage is the fourth most ordered, because it's considered medical there. Fourth most ordered procedure in all of Europe, because they believe in it so much, and it does work.
Can you explain
process of
it?
that?
Can you explain that? So
A little bit of lymphatic
Because
drainage.
drainage sounds
Well,
like,
basically it's a manual therapy.
yeah.
And so it's kind of hard to explain, because it's not like a traditional therapy where you're doing compressive.
Right.
It's more of you're following the rhythm of the lymphatic system, so you're doing this pumping and you're doing stretching, so you're kind of imitating what the lymph system does through your whole body. But you have to be specially trained to do it, because there are some contraindications to manual lymphatic. So let's talk about that. Contraindications to manual lymphatic drainage. If you have lots of circulatory problems, if you have kidney problems, if you have respiratory problems, sometimes that can be dangerous. And that's why I have this little soapbox about now, because people are asking for it indirectly, so not going through doctors, because a lot of them are not referring, but people are reading more. So now they're looking for manual lymphatic drainage. So then everybody's taking a 5-day class, and they're hanging out their shingle and saying, oh, we do manual lymphatic drainage here. So then people are going, and then they don't have a medical background, they don't have that kind of trauma experience. So then they're doing this, and they're not saying, well, you have respiratory, you have CHF, you have this or that, and then a lot of times you can hurt people like that, heart arrhythmias, whatever, because you're moving that fluid too fast. So, and I know sometimes people will call my office, and they'll want to have different things done. I'm like, no, you need to have a medical clearance first, because you've got 4 different conditions that I could affect with what I do, and I'm pretty efficient. I've been doing this 20 years plus. So I could move some fluid really quick. I said, so you definitely need to get a clearance before I even touch you. And I know that some of them just go to other people because I'm too tough, I'm difficult, you know. But I would rather do that than kill a patient on my table or cause a problem.
It's just clarifying, it's not, you hear the word drainage.
Yeah, but
they're gonna cut you and goop's gonna come out.
Yeah, it's a special massage, manual
Right,
massage
I mean, I've had it
technique.
done, so I know, but when she first told me I had to get drainage, I was like,
Yeah.
That's what I was
So she's
like.
over here saying,
I'm like,
she's
what
like,
is
no, it's
that?
not.
Well, that's
Is it
what
like
I'm saying.
needles and
No.
out
No.
fluid or something?
So I think a couple more things. I think she brought up a really interesting point about work situations. What I try to do is when people come in, I look at the total person, like where they're working. So we talk about ergonomics at the office. I'm pretty proficient at that. You know, I can visualize their desk, where they are, you know, and we kind of talk about that as far as repetitive motion and making a plan to, this is what, you know, you're going to have to do or try to do while you're at work. Sometimes it's not possible. You know, the way you're sitting, the way you're positioning, where your computer is in up position so that you're not hanging down. Sometimes that's not possible, but we do try to. Also, we talk about sleep positions, because sometimes people get used to sleeping on that side. Or back sleeping is best. You know, so we talk about your life as a whole. What do you do? I have quite a few people, because I work in a program, I think somebody probably got a couple of brochures, and it's called SLEW, and it's actually a nonprofit for indigent cancer women. And so a lot of those women actually do housekeeping positions or positions where they're doing a lot of repetitive motion, but they can't help but do it. But then we kind of come up with these different, you know, strategies of what they can do to try to offset that. So yeah, work is very important. Sleep positions are very important. Even housework at your own house, you know, trying to employ, like I think one time we had to bring in a husband there at SLEW, because he was like, his wife was doing everything, but we kind of talked to him about, hey, you might want to help out a little. She's doing housework, yard work, she's doing it all. He was just working, coming home. But then after we kind of explained to him what was happening, she was able to actually get some help. She was so thankful. She was like, oh, he actually is doing some housework now, doing some yard work. So, you know, you have to try to get a strategy. Now, now, are there any other questions that you guys have at this point?
You didn't, I don't think you ever did answer if a sleeve would be good for me to
Well,
wear while I'm working.
what you want to do is you want to go first and see if you have an actual diagnosis, because you may already have lymphedema. I mean, we don't have a baseline on you. Well, what they would consider. So you would get a baseline measurement. You would actually go to your doctor. He may or may not be able to diagnose you or evaluate you. He may send you to a PT maybe to get evaluated.
Which doctor do I?
Well, it depends. I mean, if
I've
you
got
have
like one, two.
well, usually the oncologist, because
The
most
oncologist,
regular doctors don't even know lymphedema is not on their radar.
Okay.
So sometimes if you have a surgeon or either an oncologist that you're following,
Okay.
they're going to be the ones that know more about it.
Your PRMA doctor can send you to someone.
Okay,
Yeah.
okay, so I can ask my nurse.
So yeah, ask for
I
an
see her tomorrow.
eval,
Okay.
because yeah, that could be possibly happening. So anyway, I think there's pretty much, unless someone has anything that they want to talk about, okay? So what I usually recommend, and I tell people about Gilyard Medical Massage, and I'm going to introduce y'all to Faye before we leave here too. She's sitting over there quietly listening. Is usually if a person comes in or they call my office, what I do is I ask them questions like, have they been through physical therapy before? Have they had any intervention or diagnosis with lymphedema? Because I try to work with people from that aspect. So insurance pays for that. You want to take advantage of that, and you also want to have that on your medical record. So I always send them back to their doctors or whatever, if they're under the care with, to go through that route. What I usually recommend for them then is say, well, once you're finished that, you know, even though I'm private pay, unfortunately at this point, you want to come back and try to get some regular maintenance, okay? That's just like, you know, you go in and you lose weight and you're good for this 6 months, and then after that, you just fall off. You just start eating again, right? So even with lymphedema, you're going to get the best results is if you're actually having some kind of continuation. So what I usually do when people come in is I definitely do baseline measurements. If you have any medical records that have any, which most people unfortunately don't, that's really helpful. And, you know, of course, a lot of them already have a previous diagnosis with the lymphedema. I kind of evaluate them orthopedically also, because we talk about injuries or any kind of comorbid conditions that they possibly have that is going to influence that. So sometimes what have happened is people think they have lymphedema. I mean, I'll say that. But they actually have an orthopedic condition that's actually affecting the quadrant. So it's kind of funny. And so sometimes when we clear that up, it's like maybe that was a swelling from the fact that they had blocked circulation. So that's why you have to be really careful and get a doctor and physical therapist and all that to diagnose that, because, you know, technically it may not be lymphedema. But anyway, so I get in there, we kind of look at you as far as medical massage and kind of orthopedic look at you. Then we start to kind of do some lymphatic drainage. You know, people usually have all their sleeve, like you have your boppy, and you know, people usually by that time they have their sleeves and they have all of the things that they have, and then we just kind of do a lot of really good lymphatic work, because sometimes when you're in the centers, they don't have the time to do as much lymphatic work as I do, because they're trying to do everything else. So by the time they get to me, I'm doing some really deep work. We're doing a lot of orthopedic. And actually people usually get a better result. I have lots of my clients that don't even look like they have lymphedema, okay? Because of the fact that they do, just like a regular massage, they get regular lymphedema, lymphatic drainage treatments. And it does help train the system. It does help to establish collateral lymph vessels and kind of train those arms to do that. So that's why it's really good to be able to do that. Now, we've talked quite a bit about lymphedema. We'll just talk just briefly about post-mastectomy scarring. So I know, are there people that are really interested in a lot about that? So what I usually tell people about that is lymphatic drainage is really good for people after they come out of surgery, and we kind of talked a little bit about that. That doesn't happen very often. But when you have a lot of scarring, you know, it can impede lymphatic flow. So, you know, along with having lymphedema treatment, most of the time we also do scar tissue management, okay? And so that's very important because you can have all the lymphatic drainage you want, but if you've got all these different scars and you got all these trams and you got all this and your posture is like this because the tram's killing you, you're going to probably have more swelling just in general, and then along with the fact that if you have lymphedema, it's going to affect you. So we kind of get in and we figure out what we're going to do as far as plan to try to counteract that, you know, and get you, you know, in the proper way, you know, proper management as far as scar tissue. I tell people you got to stay moisturized, those scars, because that's one of the big no-nos that I see when I see people. I mean, it's like leather, you know, they're, you know, they've had radiation, they've had, you know, surgery scars. Those scars are so tight, they haven't had any moisturization because people are scared to even put anything on there. I think they're scared to death during radiation, so then they figured you don't put anything on that area. But that is not true, because you're going to have a lot of problems with restriction, not only in that skin area, but with the joints too. So then you can't lift the arm all the way. You're just like, oh, right there. So I tell people that you want to do natural things like coconut oil and shea butter mixture is so good. Sometimes you can put a little aloe vera in there too. You want to do things that the body recognizes as food, because a lot of people will say put these heavy ointments and full of this and full of that, and that's not good because your body is an organ that actually drinks. So you're going to absorb all of that. If you have lymphedema and then you put a lot of chemicals on, then your body has to try to fight those chemicals off. The body recognizes food. It recognizes natural things, so therefore it's less stress on the actual part, okay? So then you're not having to fight that. So also, as far as treatment in session, I'm also an esthetician. so I have a skin soapbox too. You know, we do a lot of different things from companies, and most of them do not originate here, but they do a lot of things that are really natural, stuff from Hungary, different places where they're just space age ahead of us here, and it's almost like you could actually eat it out of the jar. Mm-hmm. And then we use a lot of, you know, different products to try to treat the skin and keep that skin loose, because we need to keep it loose, we need to keep it moving, we need to keep, you know, and it's not all scar tissue. There is some live tissue underneath there, so we need to definitely keep that healthy, because that scar tissue will just start choking that off too, and it's just a chain reaction. So we don't want to do that, you know. Also, a consideration is if you're going to have future reconstructions, expanders, all of that, you want to actually start treating that skin. And the skin sparing, all the different surgeries they have out there. So, you know, we do a lot of moisturization in there. We do a lot of scar work. We keep that skin loose. In fact, I have a story. I used to work with burn soldiers returning from war. And so a lot of them, they were burned over a major part of their body. So they had very little skin to graft. So of course, if they had chest surgery, a lot of times the doctors would put expanders in right there so they can stretch that chest, so they can harvest that tissue to transfer it to other places. So men are not used to having breasts. So when they're feeling all them CCs, they're getting bigger and bigger, and they're wearing these big old jackets because they don't want nobody to see that. But then they're in pain. Like, that's all they're like, how do you women do it? Because we just crazy. So what we would do is go in and we would loosen that up. We would make sure that stays pliable. It would actually keep the swelling down, you know, and they would actually, it was more for them for pain relief. Okay, and so then after they would slice it and harvest it and graft it, then we would actually help close the wounds with lymphatic drainage and be able to keep that tissue soft and pliable so it won't just harden up and restrict. You know, because they already had a lot of problems because they're being burnt, you know, their joints and everything. I mean, they're burnt, some of them 80. I had one that was burnt. The only place he had 3% on the top of his head. They had to strip a cadaver to graft him, and he had like 80 surgeries by the time I even met him. So when I was working with him, so I work with those type of clients where they're basically being put back together. And so we've had to do a lot of skin things, a lot of scar, like, you know, I never belittle what journey people go through, especially cancer, because I can't imagine. But I've had people that they have ropes that are scars that I've worked on. So, you know, I'm like, you know, so when I see vasectomy, I'm like, that's workable, you're good, you know. But, you know, I've worked with people who are really, really trauma, you know, helicopter crashes and trying to disassemble bombs, you know. So yeah, there's not much plastic surgery I haven't seen. So that's kind of how that is as far as lymphatic drainage is very helpful for, you know, all of that. But anyway, also I wanted to not leave here without introducing other people here. This is Faye McCarsky. And so, Faye, can you come up and tell a little bit about yourself?
I don't have a whole lot. I came to massage therapy kind of late in life. Kim talked about soldiers and helicopter pilots. I spent 21 years flying for the Army. Fortunately, didn't crash any. It was during a tour in Germany. I was born and raised in Lower Alabama. We call it LA. When I was growing up, I like that. When I was growing up, if you said anything about I want to go get a massage or I want to do a massage, well, your mom would, you know, it'd be like soak your mouth out there. That was what bad little girls did. So you grew up with that mindset, and it wasn't until I spent 3 years over there and single at the time, and on Friday nights, rather than going to the O Club and swilling beer, I'd wander downtown, and I found myself in a large, like a sports complex. So you could do, you could swim, you could go to you could get in the hot tub, the saunas, the ice bath. And then when you were all done, you could go find yourself a massage therapist. And I decided I was going to be a bad little girl and go do that. And it became an every Friday night thing. I didn't speak much German. A lot of them didn't speak a lot of English, but we communicated. And I thought, you know, after getting out of a helicopter, you know, 3-4 trips a day, you know, the old lumbar area gets pretty sore. And when I came back, I was a commander of a company, and most of we were in the Guard then, but these guys were Vietnam vets. And sometimes, you know, we had to use some shoehorn and Vaseline just to get them in the helicopter. And you get them back out 2 or 3 hours later. It was really bad. And you know, so I did a little massage therapy there, and eventually wound up working with one of my cousins who had breast cancer. 16, 20 years ago, doctors said, you know, well, don't do massage therapy on cancer patients, it'll spread. Well, she was unfortunately terminal, and the thought was, can't hurt her, can't help her, so go right ahead. And her hospice nurses were massage therapists, and I learned a little bit of what to do when they weren't there, and all of a sudden the light bulb went on, and this is what I want to do. So when I was able, I finally went to massage therapy school and turned right around and went to a class taught by a lady named Gail McDonald. Gail and Tracy Walton probably literally wrote the books on massage, oncology massage. So that's my specialty. I love oils. I love relaxation stuff. Too old to do the deep work, don't like it anyway. So I do some lymph drainage when Kim tells me to and tells me how to do it.
She's
We've
certified.
been through. I like working with Kim because she can talk to that particular, talk to the doctors. I can't do that, but that's why I enjoy working here, and love to see you ladies in the future. If nothing else, a good relaxing massage. If everybody had one once a month, then boy, we wouldn't have the problems in the world we do. Cards over there. Give a yell. Good to meet you all.
Nice to meet you.